No, being bedbound at period time is not some kind of sadistic way of training you to go through labor. Good day, I'm Dr. Tia, and today we're talking dysmenorrhea, which is period pain. Now, period pain comes in many flavors. The most common is primary dysmenorrhea or period pain for period pain's sake. This tends to start from the get-go, so you have your first period and they come with pain. And there's no other cause as to why you are having period pain. Even so, that doesn't mean that that period pain should make you miss school or make you miss life in general. That can be managed with simple pain relief, naproxen, mefenethic acid or Ponstan, Nurofen, Panadol, heat pack, and you can try and figure out if that is adequate. There are other reasons though that people can have period pain. These are called secondary dysmenorrhea, secondary causes of period pain. These include endometriosis, which is when the lining of the uterus is shedding and it is now outside the uterus. This tends to be period pain that starts before the period, a few days before you start having back pain, lower abdominal pain, pain radiating to your legs. That can be incredibly severe. You can also have adenomyosis, which is endometriosis, but instead of shedding outside the uterus, the lining of the uterus embeds itself into the muscle layer of the uterus. That is called adenomyosis and can cause increased period pain. Some people have a lot of period pain because they have infection, like pelvic inflammatory disease. Now that is pain in the pelvis that shouldn't just come at period time. And so when a doctor is taking a history to clarify why you might be having period pain, they might ask you about just pelvic pain in general during the whole cycle, from the beginning of your period to when you're ovulating or when the champion egg of the month is released and before the subsequent period. And those questions are to clarify what kind of pelvic pain are you describing. Some patients also describe having pain during intercourse, which is called dyspareunia, which can also guide as to what could be the cause of the pelvic pain. Some people have congenital anomalies, as in anatomically they're a bit different, and so that can explain why they have period pain from the get-go or even a bit later. Some people might have fibroids or polyps that impact their pain and volume of blood loss at period time. Now, the treatment, as already alluded to, involves a lot of management of the pain, simple pain relief, heat packs, TENS machines, etc. If you're not trying to fall pregnant, a period is a memo that you didn't fall pregnant 2 weeks ago when you ovulated. And so, unless you're trying to fall pregnant, you probably don't need to have a period. And by reducing the number of periods you have a year, you might not actually even have much period pain. So some contraceptive options such as the pill or the Mirena can allow you to not have periods at all, which then means you're not bedbound, every month to manage your period pain. Kindly discuss such options with your general practitioner. And no, being bedbound at period time is not some kind of sadistic way of training you to go through labor. Please see your GP for help. Life does not need to be this tough. We are in the modern medicine era and can help. Till next time, see you later.